Well, good morning, and it is a pleasure to be here with you this morning. When you were talking about upstream investments, policy planning, it sounds a little boring, but actually it's very exciting. It's exciting to me because it's really about the choice that we're making at the county about how we move forward. And that's very important because, as many of you know, we just came out of this huge recession that not only did that impact government, it impacted business, it impacted the nonprofit sector, and I think most importantly, it impacted families and children. And so as we come out of this recession and as we come out of thinking about how we move forward as a community. And so prior to the recession, the County Board of Supervisors was concerned that over 50% of the general fund budget was going towards criminal justice costs. This was pre-recession. And there was talks about the need to build a new jail in Sonoma County. So rather than building a new jail, the board asked the county administrative officer, what else could we do or could we invest in that would create a different trajectory for young people? So rather than incarceration, what other investments could we make? So the Department of Human Services was charged with the task of studying the issue for a year. And what they concluded was that there's actually a lot that could be done, right? We know, and you know, that, give you some statistics, we know that if children are not reading at grade level by 3rd grade, that's a proxy for dropout, and that's also a proxy for how many prison cells some of the states are going to need. So we know that early literacy and education is so important in the equation, and that there wasn't just several things that we could do, but that there was actually some programs that worked better than others, that had efficacy, that actually have been proven, once replicated, to work over time. So the department created this Upstream Investments Initiative, which is really a philosophical framework for how the county can move forward to address some of the underlying root cause issues. Things like poverty, right? We know that's a very complex issue, but poverty is a root cause issue that can lead to criminality. We know the importance of community, right? We know the importance of having a strong social network. You know this as Rotarians. You have social capital. Yet we know that there are many communities who lack that for a variety of reasons. We also know that policies impact the work that we're doing. Very harsh disciplinary school policies that basically have zero tolerance. If somebody comes to school with marijuana, they're automatically expelled, right, in many cases. Well, a lot of the research tells us that if you've been suspended or that you've been expelled from school, you are 70% less likely to go on to higher education. So we've had this many years of having harsh school policies that have resulted in many students not achieving academically. And when we look at data in Sonoma County, we see that among our Latino population, we see great disparities in the achievement gap. So policy matters. We also know that we've got to focus at the peer and individual level, right? That we've got to really help people overcome whatever obstacles are getting in their way of success. And we know the importance of having strong, functioning families. So rather than building a new prison, we said, let us not address the symptoms, but let's begin to address the root cause issues. And that is what is now Upstream Investments. I wanted to share just this slide. This is from a report that was published just recently called The Portrait of Sonoma County. And you may want to have a presentation on this, but it basically, what the Portrait of Sonoma County does is it looks at census data by census tract, and it assigns an index based on 3 factors: life expectancy, educational attainment, and median income. And so in Sonoma County, we have 99 census tracts. And roughly there are about 4,000 people per census tract. And it assigns an index, 10 being the highest, 0 being the lowest, 5 being on average. And this is an important study because it allows us at a very basic level to compare differences between neighborhoods. So for example, I just wanted to share with you that when we look at race and ethnicity, that our Asian Americans do much better than whites and much better than Latinos. And that Latinos in Sonoma County, the index for education, it's 2.37, meaning that they are less likely to graduate on time. Many of the family members or many of the parents have not completed high school, and I think roughly around 8% have a college degree. So this index allows us to see huge variations along race and class. And to give you just a quick example, when we look at the community of East Bennett Valley, almost 100% of that population has a high school diploma versus Roseland Creek and Roseland neighborhoods were roughly about 53%. So we begin to see why place is so important, right? That your address is a proxy for opportunity. And so part of our charge here in Sonoma County is how can we work together to lessen those runs of disparity and actually create more opportunity for more of our residents. The interesting thing is that Latinos actually are healthier overall than the rest of the populations, and there's a lot of speculation about why that is. It could be that there's stronger family cohesion, there's more intergenerational living. There's others that suggest that because most of them are immigrant population, come to this country, they're healthy, young, working, but they go back to their native countries to retire, and that's where they eventually die. So that could also skew the numbers. But nonetheless, when it comes to income and education, Latinos in Sonoma County are not faring well. And why that's a concern to all of us is because here in our community, we are graying and we are browning. So we have these huge two shifting demographics where our population is growing older, and that presents new opportunities and new challenges, and a younger demographic that's going to be the future workforce. So if we're not focusing on education, that's going to become a problem for us down the road. So again, this is just something I pulled from the report. How do I go back up? Well, just to illustrate that different communities just being 5 miles apart have huge differences in opportunity. So East Bennett Valley has an index of 8.47 and Roseland Creek of 2.79. And on the left side of the screen, you see that the index for Roseland is less than for the state of Mississippi. So we have some huge disparities, but this is not a surprise to all of us, right? We know that certainly like in Santa Rosa, we have huge disparities along the freeways, Southwest Santa Rosa having greatest challenges. So our mission with Upstream Investments is really to reduce the financial and societal cost. We know that it costs roughly about $9,500 to provide a year of quality preschool education versus $40,000 to $60,000 to incarcerate a young person. So it just makes complete sense why we should be shifting our investments early and getting to the issue early on. We want to help to eliminate poverty, to ensure equal opportunity, and to make sure that we're providing nurturing home and community. And we're doing this in 3 ways. This concept of investing early, investing wisely, and investing together. In the area of investing early, we want to address the issue as early as possible. So focusing on prevention wherever possible. And people will say, well, does that mean we have to just work with children? And the answer is no. We know that our aging population is living longer and living healthier, but there's a lot of things that we can do preventative to ensure that they're developing or that they're growing, that they're aging well, right? So education around protection from falling, nutrition is so important, oral health is so important for our aging population. So there are things that we could be doing around prevention. So the key here is get to the issue before it becomes problematic, and from a cost benefit, we know that prevention is much cheaper than dealing with chronic issues. So we want to invest in programs that improve lives and across the whole lifespan, right? From birth, prenatal actually, until the last stages of life. And so we are identifying different programs that are doing that. In the area of investing wisely, right? As I said earlier, there's a lot of services that are being offered in our community, and we know that some programs are more effective than others. This idea of evidence-informed practices, right? So we as a community are investing and working with our partners to elevate our collective understanding of what works. And what we mean by that is when we look at programming, we ask the organizations that are developing those programs, we ask, what evidence do you have or what literature do you have that supports the efficacy of your program? You know, what does your logic model look like? You know, help us understand that here's the issue you're trying to address, what's the intervention you're trying to implement, what are the short-term changes you're looking to see, and what are the long-term changes that you hope to achieve. We have to move away from this idea of outputs, right, where we're saying, well, we fed 500 people, we provided services to 225 children, we had 400 people take these classes, to this idea of outcomes. As a result of what you provided, how are people's lives better off, right? And for how long? So funders are really looking at this idea of impact, right? What has been the impact of your investment? But one of the challenging things about impact is that it's not immediate, right? And when we talk about complex issues like closing the achievement gap, that's long-term work. And so we have to embed these milestones or these feedback loops that tell us that what we are doing is working. So this is a real game changer in our community, both in how we invest and how we support our community in utilizing best practices to deliver effective programming. One of the mechanisms that we've developed to help our nonprofit community primarily, and even our own county departments, because we expect that every county department utilize the portfolio or upstream philosophy to improve and enhance their service delivery. So we've developed this portfolio of model upstream programs. It's really a clearinghouse of what programs work. And we have 3 tiers. You know, tier 1 is a strict evidence-based program. It's had a clinical rigor, right? It can be replicated. There's evidence that it works. We have a lot of national models. Nurse-family partnership is one of these programs that you have a public health nurse working with first-time mothers, working with them over a 2-year period. The benefits of that is if you can help address the nutritional needs of the mom, you're going to have children that have normal birth weight, reduce the amount of hospital time, less, if there was any substance abuse, less substance abuse. You're going to lengthen the time between pregnancies, so to really empower that young parent to make better choices moving forward. So that program, when they did the cost benefit of that, is for every dollar invested in nurse-family partnership, you get a $17 return in savings to the other parts of the social service system. So this is very important. Tier 2 are programs that actually have a literature review, they have a sound logic model, they have an evaluation, that have data that tells us if the program is working. And tier 3 are those emerging programs or innovative programs because we want to promote innovation. But there is an expectation that those programs have done a literature review, they've scanned, you know, other research and other studies, other programs, and say, this program has worked, we want to take parts of it and embed it into our program, and they have a commitment to evaluate, right? That's a new process that we're doing here, evaluation, because we need to know, and funders want to know, how are our investments working? Unfortunately, a lot of the funders and government, they don't fund evaluation. So this is a commitment that we're trying to make to really fund evaluation. So this portfolio now becomes very important because organizations can submit their program. There's a committee that evaluates the program and assigns a placement on the tier. Now, we don't say that tier 1 is the best, right? It is a gold standard, but the goal should not be to get to tier 1. The goal is to get onto the portfolio. And we're working with funders who are now prioritizing and are providing bonus points to those grantees that submit the program to the portfolio, because what that is doing is that's elevating our collective understanding of what works, and it gives investors a peace of mind that the program on the portfolio has had some rigor, both in program design and in how it's going to be evaluated. But we know that nonprofits may not always have the resource or the capacity to invest. They might not have an evaluator on staff. So the county is investing in providing training and technical assistance. So we have staff that go out into the community, working with our nonprofits, helping them to understand how to develop a logic model, how do you do the research. We help them do that as well. And we also understand that many nonprofits don't have the data collection tools or the software to collect the data to be able to measure and monitor their progress over time. So we are purchasing a data collection system to give to our nonprofit partners so that they can collect data. So we're sort of changing the relationship that was before, where as the funder we were looking at monitoring for compliance, right, for oversight. Those days are over. What we're really talking about is a partnership. How can we make sure that our grantees who utilize our resources be successful in having better outcomes for the people that they serve? And that's very different, because when you have a relationship and not one that's driven by compliance, you can begin to talk about what's not working. And we want to know what's not working so that collectively we can begin to work together and understand how we can address it. So our portfolio of upstream programs has been very successful in working with over 100 organizations now. And we have about 75 different programs that are on the portfolio today. So the key thing is we want to invest in what works. So here we have 25 in Tier 1, 27 in Tier 2, and all of this is on our website. If you want to know more about what those programs are, you can go to www.upstreaminvestments.org and you can learn all about these programs. If many of you know that the Sonoma County Vintners and the Sonoma Valley Vintners are hosting their big wine auction this weekend at one of the wineries. And we work with them using the portfolio because they wanted to know, in the area of early childhood education, what are the best and most effective programs in Sonoma County, right? And they used the portfolio as a basis for how they were going to invest. And why is that important? Because they're going to go out and ask the wineries to raise $1 million to focus on early childhood education. And those investors want to know, are we investing in what works? And through the portfolio, we can say with a high degree of certainty that yes, these programs have fidelity, they've been proven to work, and they are a good investment. This is just a quick example of the process. I'm not going to bore you with it, but basically we help the organizations plan, we help them apply to the portfolio, the committee evaluates, we generate a report with recommendations if they didn't get placed on the portfolio. The goal is for them to integrate the practice into their organization and to use it for continuous quality improvement. Right? This is the cycle that we want to promote, not just with our nonprofit partners, but with our own internal government programs. And the last thing is this notion of investing together. We know that the complexity of the issues that we deal with require a lot of investment and a lot of coordination. Right? No one single entity or no one single organization can address these issues alone. When we talk about issues of poverty or mental health, behavioral health services, allowing people to age in place or age in community, closing the achievement gap, these are complex social issues that require coordinated solutions. So one of the things that we've been talking about is that we have a shared vision for Sonoma County. And through the work of Health Action, we have developed this vision that we want to be the healthiest county in California by the year 2020. A place where we can all work, live, and achieve our full potential. And I want to underscore the word all. Right? We want to make sure that we can all, because when we all do better, we all do better. We want to look at mutual support. This idea of competition, we know, can get in the way of really engaging in meaningful and deep collaboration. We want to focus on strong communication over time, because the work that we're trying to do will not be solved overnight. So we have to have that long view. You know, this is a marathon. This is not a sprint. And we have to have backbone organizations that can manage and monitor the work over time. And in Sonoma County, the County of Sonoma has emerged as that backbone organization where we are facilitating, we're convening, we're bringing different cross-sector organizations together to address these issues. We're providing the data, the evaluation, and the research to support a lot of the work that our community is doing to get done. Why is that important? Because the county's not going to go away, right? We have organizations that are struggling to, get the resources to deliver programs, but the county's not going to go away. And we've made significant investments to really be a strong backbone to support our community. Again, because we recognize that, for example, schools can't address student success alone, that government cannot continue to provide services as the need increases. So we have to look at other models. We have to look at building community resiliency in children and in families, and expand and relook at this notion of mutual aid and support. How can we build strong communities so that we can have less of a need for some of these services? So investing together is so important. And already we have this funder circle where we have about 20 different funders who have come together to really look at the portfolio to be able to make funding decisions. So, a funder like the City of Santa Rosa, through their Measure O money, this is their gang prevention program, where they're mandating that all of the grantees have to submit their program to the portfolio within 1 year of funding. They're now focusing and funding the evaluation. Organizations or foundations like the John Jordan Foundation looks at the portfolio to make funding investments. We provide bonus points. If your program is on the portfolio, you get bonus points. So we are incentivizing organizations to go through the rigor of getting their program onto the portfolio. This is also the word collective impact. I don't know if you've heard about collective impact before, but this is really a new way of how we move forward working together, right? This idea of, do we really have a sense of what's going on? Do we have a common understanding of the issue? Are we looking at shared metric? And what that means is, are we comparing data? And are we looking at apples to apples? And can we see the progress over time? Again, communication is so important, and then the backbone organization. So we have institutionalized collective impact across all of our programs in Sonoma County, at least all of our major initiatives. And here's a list of all of the funders that are using the portfolio to make funding decisions, whether it's bonus points, whether it's asking us to come in and provide technical assistance, help organizations with actually writing their grant, and helping them to gain a greater understanding about what are the ingredients for success in developing and designing a program. So we do have staff that provide training and technical assistance, and you as a funder, I'm sure that you provide grants to different organizations. You might have a school that comes and asks you for money. We want to implement this program. You may say, what information did you use to design your program, and how is that working? So this is another way that you can support our work. We also ask organizations to submit a resolution of alignment, basically saying that we believe in the principles of upstream investment, and we want to align our organizations to support the work that you're doing. And we have 76 local organizations that are doing that, including funders and cities and governments. So with that, I'd be happy to take any questions. I know we have just a few minutes.
I'm so grateful that we have you to serve our county and our community in such a comprehensive way. Could you give me just a taste of what programs are available for young people who have peers or family members who are not promoting good choices, who are not helping them become better community members? Do you have some programs that are really hitting the mark in that area?
Yes, we do. So one of the things that you can do is to go onto the portfolio. And what we're trying to do is to revamp our website so that somebody wanting to know that very specific question could plug in those categories. So I'm interested in programs that serve youth in the area of behavioral support services or family engagement, and then it'll tell you these are the programs that are providing those resources. But we do have, for example, 2 programs that provide parent education, positive parenting, and we do have some school-based services that are actually addressing people to make better choices, right, to engage in pro-social behavior. So I would encourage you to go onto the website because there's 76 different programs, and there's a description of each of those programs. And then where we want to get to is to show a map. When you click on that program, it'll tell you in which part of the county is that program being delivered or in which school district, right? So again, we see this as a huge resource to not only investors, but just the general public who wants to know, here's an issue in my community, I want to know how can I advocate to bring more of these resources.
Thank you, Oscar. If there's any other questions, if you would maybe stay a few minutes.
Great, thank you very much.
Well, I have a question for you all. How many bought tickets for the raffle? I know Laurie did. Okay, so there's enough that's worth doing a raffle. So, Oscar. Okay. I'm going to ask you to draw a ticket down here, and there's a lot of tickets in there, so we're going to have to draw several before I find a winner. Just read the last 4 digits.
2825. 2825.
Try again.
2821. 2819.
A big wiener, huh?
A big winner. Well,
Where's the cards?
we don't have any cards. So,
So what do you want?
Flip a coin.
I'm thinking of a number between 1 and 10. I'm going to write it down right here.
There were more cards than that.
And if you guess that,
Cards?
Between 1 and 2.
say,
Oh.
ah,
But.
look at this beautiful book. And Patty would like that because it talks about gardening. And that's the American
Thank you so much.
garden.
Appreciate that.
You're welcome. When Nancy left, she passed the mantle to Dan Needham for our joke of the day.
Well, I was in Michigan, North Woods for a couple of weeks, and I came back with beard as my souvenir. But tried to sample the local foods and see the local scenery and experience some of the local customs. So they've got a bunch of different types of community organizations up there as well, like we do here. And to not be specific, and I'll take this was visited the Order of the Woodchucks. So I went over to one of their fraternal organizations, and they were having a meatball feed, and they were talking about how they all got through the very hard winter where 90% of the lake froze over, and what they occupied themselves with during the winter when there's only 700 people in this town. And so anyway, I made a woodchuck joke, and it didn't go over very well with one of the people, and he came over and he literally lifted me up off the ground and said, "I don't appreciate how you talk about my brothers." And I said, "I'm just joking around, we'll get over, we're just having a little fun here." He didn't like that explanation. He put a razor up to my throat. If it had been plugged in, I wouldn't be here to tell you about it today.